All right, welcome everyone. This is where we're looking into the cardiorespiratory model, where we're going to be describing how the heart is connected to the various respiratory system as part of the pulmonary circuit. So let's just give a very brief introduction into what we're looking at. So you're looking at the anterior view of your chest cavity, where at the top here, you're looking at the throat or neck area. So if I zoom in on the top, you can see the glottis and the epiglottis, as well as the other structures that are associated with the larynx, like the hyoid bone, the thyroid cartilage, the thyroid gland. This aspect of the neck area will be covered in much more detail under the larynx model. So what I'm going to be focusing on in this video is the bottom portion, where we're going to describe the heart and how it's connected to the adjoining organs like the lungs and other areas. So we have the heart. This is the anterior view. Again, the heart is part of the cardiovascular system, made up of two circuits, the pulmonary circuit and the systemic circuit. This is going to focus on the pulmonary circuit, where the heart is going to pump blood out of the right ventricle through the individual pulmonary arteries so that they can go to the individual lungs for reoxygenation and then come back to the heart. So let's remove the heart here and see some of the structures that we can identify. So as you can see here, the heart itself is covering some very vital organs. This ridge structure that you see here is the trachea, where the trachea comes down from the larynx and then divides into the individual bronchi. So now they're going to split into the right lung and the left lung. This is called the primary bronchi. Once these bronchi enter into the lungs, you can see that they further start to branch off into smaller and smaller individual structures. This is where you have that tree-like structure of the bronchi, so primary, secondary, tertiary, so on and so forth, as they get smaller and smaller, eventually becoming bronchioles, where they end off into the individual alveoli. The other thing I would like to indicate here is these C-shaped cartilage structures. You can see that they follow along the bronchial tree. Eventually, they start to disappear once you get down to the bronchiole levels and they get into the alveoli. This is what's keeping the trachea and the bronchi branches open. The bronchioles themselves, on the other hand, can change in their overall diameter depending on what kind of airflow is needed. So you can open up your bronchioles if you want more air to enter into the lungs, or you can also shrink them to a smaller size, for example, when you're resting. This is also where you talk about what's called bronchial spasm, where during an asthma attack, these individual bronchioles can suddenly shrink due to some kind of irritant, for example, and that's what makes breathing difficult during an asthma attack itself, because that restricts the flow of air through these individual bronchioles as they're terminating into the alveoli. All right. Some of the other structures that we can see here is this is the aorta, where you have the aortic arch connected to the heart itself, and now it's going to go down into what's called the descending aorta to go towards the abdominal area. Right behind the trachea, so posterior to the trachea, this white structure that you see here, this is the esophagus. This is what's responsible for taking food from the oral cavity down to your stomach, that would be located down here. So I want to focus a little bit more on the lungs themselves. So we have the right lung on this side, and we'll have the left lung on this side here. If you look at the structures of the lungs from the top, you can see that there is this little ridge that separates the lungs into individual lobes. The right lung has only two lobes, the superior lobe and the inferior lobe. The left lung in this case would have three individual lobes, as discussed in class. You would have the superior, the medial, and the inferior lobes themselves. In terms of the overall structures of the lungs, this is also where you, of course, have the exchange of gas taking place. So as I mentioned earlier, when the blood comes from the pulmonary circuit, from the right ventricle, enters into the lungs, we have reoxygenation take place, and then they come back to the heart via the pulmonary veins, shown here with that oxygen-rich blood, to then enter into the systemic circuit. At the bottom of the lungs here, this structure, like a dome-like structure, is where you would have the diaphragm. This sheet of muscle is very much important in the dynamics of respiration or breathing in and out, where it is, in this case, responsible for pulling the lungs down during the inspiration process. So you will have the lungs, in this case, expand because the diaphragms become much more flat shaped. And then during the expiration process or breathing out, the diaphragms will relax back to the C-shaped structure, pushing the lungs to a smaller volume and helping the air get out as part of the respiration process. That's all we have for this model. Thanks.